Hello, I'm Matthew Weinstock with Hospitals and Health Networks. For the past several months, the AHA has been fielding a survey that's taking a look at the changes in marketplaces from ACOs and bundled payments and patient-centered medical homes. We've been covering that in a series of articles in HNHN, including the May cover story, which takes a look at the ACO market. I'm joined right now by Christy Remedios, my colleague here at Health Forum, to talk about the survey and what kind of trends she's seeing in the field. Christy, thanks for being with me today.
Thanks, Matthew.
So give us a little sense of what the survey is and why it started.
Sure. So in the spring of last year, we launched a standalone survey called the Survey of Care Systems and Payment Models. Real purpose of it is to track and monitor the evolution of new care systems that are emerging in the marketplace. The history is back in 2011, we did a care coordination survey that touched upon some of these points. In the past couple of years, our AHA annual survey also included different metrics such as ACO engagement, patient-centered medical homes, and we just felt the timing was right to do a standalone survey.
And did you feel like that the impetus was because so much is happening in the field, and whether it's health reform or private payers pushing that envelope?
Absolutely. So we reached a point with the Affordable Care Act. CMS had announced the Pioneer ACOs. Everybody, if you pick up a newspaper, you're hearing about it. And we thought as an association, it was time to really look at the totality of all the information and not just one thing that happened today or something that happened next week. We need to study it as a whole.
And how does it compare to other surveys that may be out there from other groups that are trying to study these market changes?
We really are not just solely focused on ACOs. That's one piece of the puzzle. It might be one approach for some organizations, but we've really seen people engaged in patient-centered medical homes, clinically integrated networks. Are they accepting bundled payments or not? What are their safe transitions like? What's care coordination look like? So we want to take a really broad approach.
Great, so you've been fielding it for a few months now. What's been the response like from the membership?
We have over 1,500 respondents so far, about 30%, which we're really excited about given a first-time survey.
And so what are you seeing in the numbers in terms of ACOs or bundled payments or patient-centered medical homes? What's the data telling you?
Sure. So when we ask about ACOs, we're asking them a couple of things. It's not just a straight yes or no. We asked if you were leading it, if you were part of it. No, not at this time, but you're definitely working towards it. You didn't know, or simply no. So when you take a look at those that said yes, that they're either leading or part of it, that's about 15%. If you add in the folks that are really working towards ACO, that bumps up to 22%. So you do have the majority are not engaged in ACO at this time.
And what does that tell you about sort of broader conclusions that may be going on in the marketplaces?
You know, it's a really good question because I was actually more interested in the people that said no. And what I found is that just because they said no doesn't mean that they're not moving towards or working or looking like an ACO. They may not have the name, but they're doing a lot of the care coordination and the work behind it. About 30% are doing patient-centered medical homes. Another 30% are engaged in clinically integrated networks. So although the percent is high, the activity is also high.
And is there a slice that you might look at that maybe there are segments of the field that are doing everything?
You know, that's a great point. That's exactly what I'm looking at right now. It's the group that said yes to all three: ACO, medical homes, and clinically integrated networks. There's about 240 organizations in that crowd. And we're really taking a deep dive to say, what do they, you know, what are their lessons learned? It might be a small slice, but I think they have some pretty large stories to tell us.
And is there any way from that data to glean what this means for patients in terms of improved care, or is it really just taking a look at how the models of care are changing?
Right now, it's how the models of care are changing. And that touches quality, it touches care coordination, safe transition. So I think it's the movement towards better care.
Great. And lastly, Christy, you've been really studying this data quite a bit. Is there anything that jumped out at you that really surprised you?
Well, really what surprised me was the fact that there's the large ACO, capital ACO, and it's really the little lowercase ACO activities and what everybody's doing. Every marketplace is different. It really is going to be driven by your size. Are you rural, urban? What existing affiliations do you have in place to fit that right approach for your organization? So that old adage, no, one size doesn't fit all, very true for this as well.
Great. Thanks for your time today.
You're welcome.
And I'm Matthew Weinstock for Hospitals and Health Networks. For our coverage of the ACO marketplace, be sure to check out the May issue of HNHN. And we'll have ongoing coverage of the survey in upcoming issues of the magazine. Thanks for tuning in.